Hi, Kathy White, certified professional ergonomist. I am here today to talk to you about a subject that is very near and dear to my heart, which is musculoskeletal disorders, abbreviated as MSDs. This is a topic that means a lot to me because it is something that I have personally experienced. I have had tendinitis, I've had carpal tunnel syndrome, and I've also suffered from chronic low back pain. I injured my shoulder at the end of last year. I also, on a secondhand experience, walked through the journey with my mom and her carpal tunnel syndrome, her surgery, and her recovery. And watching her go through all of that and how it impacted her quality of life, it really fueled my fire. And the reason that I'm in the profession that I'm in is quite due in a large part to walking that journey with her and watching how an injury related to ergonomics can cause you quality of life impact for a long time beyond your working years. I want to impart that on you because what I'm talking about today is how important it is for you to be aware of signs and symptoms of an MSD so that you can take early action, you can recover quickly and get back to your daily activities so that your quality of life is not impacted. So let's talk about what some of those signs and symptoms may be. First of all, what body parts are we talking about when we talk about an MSD? I'm going to review the more common body parts to be concerned with. We're focused primarily on the upper extremity. That is where most of the injuries and illnesses are likely to occur. And by that, upper extremity, I mean your hands, fingers, your wrist, elbow, forearm, shoulder, neck, and of course, also adding to upper extremity, low back. There's a lot of MSDs, especially in the workplace, related to low back, but it can certainly happen to you outside of there as well. About 80% of our population will suffer from some sort of low back pain at some point in their lifespan. It's really important to be aware, again, of signs and symptoms, and that early prevention truly is the cure. What kind of signs and symptoms are we talking about? We'll start with talking about numbness or tingling. That is something that you might feel in your hand. It might feel like a burning sensation. It feels like needles going up and down your fingers. That is an early indicator that there's something going on with your nerves. They might be entrapped. You might have some swelling going on along your tendons, joints, muscles. Something's inflamed. Early indicator about taking action. You might also notice in your hand reduced grip strength. Also, as you're thinking about your joints, any kind of swelling that you're experiencing or stiffness in those joints could be an indicator of an issue, as well as pain. And again, going along those body parts, when you're thinking about pain, something that just is not going away easily. It could be in your wrists, your forearms, your elbows, your neck, or your back. Always wanting to be aware of those body parts and how you're feeling is really critical so you can take that early action. You also want to look at your range of motion, thinking about your neck, your shoulders, your back. If you ever find yourself limited in motion in any of those areas, that could be another early indicator. You also should think about your eyes. If you notice they're dry or itchy or sore, if you notice any kind of blurred or double vision, there could also be an indicator of cumulative stress going on with a lot of eye engagement activity. Finally, some other indicators, any kind of aching, tingling, cramping, weakness. Again, scanning all of those different joints that I mentioned and being aware that if there's something unusual you're feeling along any of those signs or symptoms, it's a prompt to stop, take a rest, break away from that activity that is contributing to that feeling and see if it subsides. If you're able to take early action, chances are really good that you're going to be able to recover quickly with some rest. If you continue to try to work through, those signs and symptoms will likely increase in intensity. They could wake you up at night. And when you start to get to those points, it's going to take you longer and longer to recover. And if you continue to ignore, you could wind up in a really serious situation where you are looking at treatment beyond first aid, talking about things like invasive surgeries, which you definitely want to avoid. Even if you do have a surgery, you may not ever be able to fully recover and get back to the activities that you were engaged in prior to that injury occurring. And that is the key point that I'm hoping to get across to you today. Always listen to your body. Your body knows what's best. If you're able to take action early, identify those signs and symptoms, listen to your body, take that rest, seek medical assistance if necessary and you need some direction or symptoms are not disappearing, please report that to your healthcare provider and get the help that you need so that you can make a quick recovery and get back to all of those great things that you want to be doing. Thank you so much for taking the time to listen, and I hope this information helped increase your awareness on how to reduce your risk of suffering from a musculoskeletal disorder.